How do you recommend, or what do you recommend for a person to get started using it?
It's a very good question. It is amazing that a small amount. My wife had a patient, a Parkinson's patient, who came to the house, could hardly walk, and we gave her an 8-ounce bottle, which she started using a little bit each day. And in 2 weeks of using a little bit, I mean, here in Brazil we don't have bathtubs, so people just spray it on. Mm-hmm. She was spraying on a little bit, and in 2 weeks she came almost dancing into the office here, and showed about. She reported that she's about 60% better in 2 weeks.
Wow.
And that was using a little. She was using much less than I would have recommended. Actually, she's my wife's patient, so I didn't have much of an avenue to intervene. But so you can start if you're very magnesium deficient and your disease, whatever disease condition, and that varies greatly with magnesium because it's involved in so many physiological processes that if you're very magnesium deficient, you can, even using a little bit can show dramatic results very quickly.
Of course, a little bit of magnesium has quite a bit of magnesium chloride in this solution has quite a bit of magnesium in it. I mean, in your book it mentions an ounce equates to roughly 3,300 milligrams of magnesium.
Right. Uh-huh.
And so even when you're pumping a few sprays on there, you can easily get the RDA just by spraying there a few times.
Mm-hmm. Yeah, it varies. There's a case I write in the book. There's a magnesium researcher who's a retired gentleman and a doctor, a pediatrician, and he has had diabetes for, I guess, 30 years, whatever, and he has diabetic neuropathy. He supplemented with 20 grams a day, which I think translates to 36 pills every 4 hours. And using 20 grams, which is 40 times the RDA or more, probably almost 50 times the RDA, he actually cured himself of actually regenerate the nerves in his feet.
Oh, my goodness.
There's not much. I'm one of the few people, or only people, who are just beginning to promote mega magnesium therapy. I personally have about 2 ounces put on my skin every day, or about 5 days a week, and I'm healthy. So when dosage, you can start. My recommendation for everybody when they start is to start out slowly. Because some people, the magnesium chloride solution is too strong and it'll burn their skin a little bit. Some people, maybe 1 in 10, 15, might have a little rash. Sometimes there's a reaction. So I always say to start out slowly, let the body and the skin get used to it. Of course, if you put it in the bath, it's much more gentle. So you can put a lot in the bath, and very rarely you'll see any kind of reaction to it. Mm-hmm. So I say start out slowly and build the dosages. Because basically what everybody wants to do is bring their cell levels back to normal. And even using a lot, I mean, really pumping it in and putting a lot in the bathtub. When I mean a lot, putting 4 ounces in the bathtub or 3 ounces, it still takes about 2 months or 3 months to really bring your levels back up. Because the magnesium is very tightly controlled in the blood. So to get it into the cells. Now, of course, transdermal is ideal because you're putting it all over the body. It's coming in. It is penetrating right into the cells. So for people in sports, it's excellent because it goes right to the muscles, which rely, sore and tired muscles just vanish with this magnesium oil.
Since most people are already deficient, you've got 2 issues. You've got the first issue is of getting your levels up to normal, whatever normal is for you, and then the next is maintenance. And so what you're suggesting with this mega magnesium therapy approach would really address the issue, first of all, of replenishing and just coming to normal, so to speak, if I'm correct.
Well, there's that, and because magnesium is actually the ultimate medicine. It's the ultimate dream from hundreds of years. It's just like a elixir of life. What you're doing with taking magnesium, as opposed to any other medicine, is you're giving the cells like a tonic. The magnesium comes into the cell or into the body, and it's stimulating or re-stimulating hundreds of enzyme reactions. The cells themselves, the cell wall permeability is moving back towards a more healthy state. It's not a medicine according to the definition of medicine from the FDA or pharmaceutical. All medicines have side effects. There's a downside because they're poisons. Now, of course, you get the medicine. They're kind of from hundreds of years. They have this philosophy or medical principle that the dose makes the poison. They say that because if you can drown in water, if there's too much of anything, it's going to be poisonous and it's going to kill you. So water will kill you if you drown in it. This is really not totally a correct principle. It's true. You can drown in water, so everything can hurt you. But like when you take magnesium into the body in a healthy form, like this magnesium, it's called magnesium oil from Globalite. It's very clean, so it doesn't have a lot of heavy metals that can bother a person. It's a very clean source of magnesium chloride. When you take it into the body and it goes to the cells, its effect is just positive. It's not a poison. I mean, of course, you could drown in it if you put somebody underwater and 10 gallons of it's going to kill them. But it's not a poison. So the effect on the cells, it's like a super tonic. It's tuning up the cells, and not in just 1, 2, 3, 4, 5 ways, in hundreds of ways. So if you're in a disease condition and you're stimulating the cells to return to some healthy level of activity, increasing the energy of the cells and the whole metabolism of the cells so they can eliminate the poison from the cell, the body only wins. So I recommend this, except for a person who has total kidney failure. I recommend this. I won't treat a person anymore who's not doing this kind of therapy, who's not replenishing their magnesium. What sense is any other treatment, any other medication or medical process, if a person is deficient in magnesium and you're not addressing that, what's the sense?
That is the point of awareness that we are hoping to get our medical system to embrace, at least to the extent of seeing it as important. I mean, there are people out there who feel that and who speak to the concept of prevention and taking steps to maintain health, etc. And yet, magnesium cannot be overlooked because if we don't have enough, good health and magnesium deficiency just don't go together.
That's correct.
All right, we're talking with Dr. Mark Sirkis, author of Transdermal Magnesium Therapy from Philo's books. Dr. Sirkis, it's evident that magnesium is important throughout all phases of life, and you have a chapter which touches upon that. What are some of the findings that or interesting findings that you came up in learning about where and when and how magnesium impacts our lives?
Well, actually, the name of the chapter is Conception to Death. You hit the point exactly. It actually demonstrates the wide possibilities for application for transdermal magnesium, and magnesium in general, is from fertility treatments. Magnesium is needed for reproductive fertility. And on top of everything, pharmaceutical contraceptives is known to diminish magnesium levels in the body. So people who are having trouble conceiving, possibly the reason is low levels of magnesium. As I said, magnesium is involved in total cell physiology, so the strength of the sperm, for example, would be correlated with magnesium levels. So in general, low and deficient magnesium would correlate with declining fertility rates. So right from the beginning, from before conception, magnesium levels is important. In pregnancy, magnesium also is important for stopping premature labor, the seizures of eclampsia. It shows its value to the entire process of life. Going towards the other, and of course, it would actually make delivery easier because the cells would be more flexible, more open, as opposed when you're magnesium deficient would be. When you're magnesium deficient, then you're more calcified. When you're more calcified, you're more rigid. So one of the reasons magnesium is this transdermal is incredible for athletes is it opens the cells, relaxes the cells. Everything becomes more flexible. I have another chapter going towards the other end as far as life extension. I have other work talking about all the minerals. It's not like magnesium is the only mineral we need, but principally it's the one we need the most of, and it's the one that's has the broadest use in the body. If you supplement with magnesium and let's say some other minerals, the chance that you can it's the greatest preventative medicine in the world also, because it's very hard to get a heart attack, stroke, cancer, or diabetes if your magnesium levels are totally topped off. If your magnesium is totally normal in the body, the chances of contracting some of the major diseases of our time are greatly diminished. So if you're not going to die or fall into cancer, heart attack, diabetes, or a stroke, your life is going to be extended dramatically. So for myself personally, because I'm in very good health, part of the reason I'm 53 years old and I have 2 babies in the house, so I want to be around for quite a while. And there's nothing I could be taking that's going to ensure my health through many years. So this is an important information and knowledge to really understand about magnesium is even in person in good health, if they want to really be around a long time and avoid major diseases, this is the way to go.
Well, yeah, because life extension and health extension are not necessarily the same thing. There are a lot of people that are living longer, but they're living with illness longer. They're living with disease. They're living with pain for a longer period of time. So their quality of life is one thing. But when you have your health, when you have your flexibility, your muscles have, strength, you're free of pain, you have mobility, that's living. It appears that magnesium is a definite facilitator of that type of life.
That's correct.
Well, now you mentioned the prenatal, you mentioned the impact or influence of magnesium even with respect to such issues as sperm count and even how it facilitates even an ease of the birth process. Is needless to say, having adequate magnesium levels even during pregnancy, that impacts the fetus itself as well. Okay. And so that it appears that there's no time in life when magnesium is less important than any other time.
That's correct. As my poem basically indicates, it's like air. You need it all the time. You need it every day. You can't live without it. And so to be deficient in air, to be deficient in water are very serious problems. Mm-hmm. Deficient in magnesium. So yes, we need it all the time.
Okay.
And as such, I use it when my children get sick. I put it in their bath water. It's a very safe, non-intrusive treatment for the children.